2024 has been a great year for Grand Mental Health. I'm very excited to come to you as the CEO for the first time. I want to share some of the things that we have planned for the next year, and I'm very excited to talk about some of the things that we've been able to accomplish this year. So Grand in 2024 has served over 30,000 unique individuals in individual therapies, family therapies. We provide treatment to those across the lifespan using a couple of core philosophical constructs to guide our services. So we've got three distinct areas that we want to look on in 2025. We want to work on bringing good, high quality services to those that need help. We want to do this in a way where we have that unbridled access, where people can get healthcare anytime, anywhere. And we want to make sure that we're able to act quickly and be able to provide the exact level of care that somebody needs. We also want to focus on the people that are working with us. Our team members are very important. The most valuable asset we have are the people working for Grand. We want this agency to be a place that fosters peace, a sense of family, and be a rewarding place to make a career. And also we want to focus on our relationships with the community. So we're very interested in working with other community partners, and we want to help fill in gaps where we can and maybe provide some additional help and support to some of those agencies that are providing good quality care. So as we look at some of the things that we're going to be expanding to provide care in Oklahoma in 2025, you can look forward to a new state-of-the-art facility in Stillwater, Oklahoma, opening in March. We are also really expanding our outreach services. This is a unique concept that we've been working on. When you consider meeting people where they're at and you consider the high need of mental health and substance abuse services, well, not everybody is as understanding or aware of where they're at in that life cycle and when they need care. So it's our really responsibility to get to individuals where they are. Sometimes that's on the street. And then also our children's continuum. So in 2025, you can expect for us to enhance some of our children-based services. We have a crisis center in Claremore. It's one of a kind, so it's a family crisis center where families come in with their kids and we're able to do an assessment 24 hours a day, see what level of care they need, triage, get them into that specific level of care. So Grand has always enjoyed a very strong relationship with the Oklahoma Department of Mental Health and Substance Abuse Services. Many of the initiatives that we're using right now and a lot of the plans that we have comes from their strong strategic plan. There's new leadership at the department, and we're very excited to engage with some of these strategic planning efforts, and we look to align with the department to make sure that we're providing the services that are going to be beneficial for people all across Oklahoma. Another challenge that Oklahoma is facing is the introduction of managed care into our state. We don't know exactly what that means for the mental health treatment of those we serve. So we have to be working with other states that have been through the managed care transition, and we have to be working on those relationships and having those strong, lasting relationships with the managed care entities to make sure that whatever we do and however this system evolves, that it meets the needs of those people coming in for care. In the next 5 years, we see Grand continuing to emerge and separate itself as a leader in CCBHCs across the nation. I see people coming to Grand and feeling like they're coming to a place where they know that they're going to get the help that they need. I see an agency that's continuing to grow to meet the demands of healthcare for individuals seeking services across the state. It is my commitment to make sure that 2025 is our best year yet.